In this video, I will answer frequently asked questions about COREG, also known as Carvedilol. Before you start, don't forget to subscribe to my channel and like the video. What is COREG and what is it used for? COREG belongs to a class of medications called beta blockers. It is used to treat heart failure, high blood pressure, and certain heart rhythm disorders. How does COREG work? COREG works by relaxing the heart muscles and widening the blood vessels. This allows your heart to pump blood more easily and lowers your blood pressure. How should COREG be used? You should use COREG according to your doctor's instructions. The dosage is adjusted based on your medical condition and response to treatment. COREG is usually taken with food. The recommended starting dose of COREG for heart failure is 3.125 mg twice daily for 2 weeks, while the starting dose for other conditions is 6.25 mg twice daily. What should be considered while using COREG? Limit alcohol intake, as alcohol can enhance the blood pressure lowering effects. Avoid sudden movements and stand up slowly. Additionally, inform your doctor about any other medications you are taking. Carvedilol may affect your alertness or coordination. Do not drive or engage in activities requiring alertness or coordination until you know how Carvedilol affects you. You should not use COREG. People with severe liver problems, bronchial asthma, or severe bradycardia should not use COREG. Pregnant or breastfeeding women should also consult their doctor. What are the side effects of COREG? Common side effects include fatigue, dizziness, low blood pressure, diarrhea, and weight gain. Rare side effects may include severe allergic reactions and heart rhythm disorders. I hope this video has been helpful for you. You can share your questions and comments with us below. Don't forget to subscribe to our channel and turn on the notification bell to stay updated with our new videos. See you in our next video. Stay healthy.